Let's begin. Well, this is an approved continuing education program, and so I'm disclosing that I do a lot of things for a lot of companies. We have research grants, I give workshops, talks, I'm on advisory boards, so that's just a matter of full disclosure. And the program today is divided into 4 segments, and each segment's an hour and a half long. So we'll do this first segment. Maybe we'll be able to finish just a little bit less than an hour and a half. We'll take our first break at 10:30, a little over an hour from now. And this first segment is going to be on some updates in the Enterobacteriaceae. Some of the new things that I'd like to tell you about the taxonomy and pathogenesis of gram-negative bacteria, and some of the new diseases that we're seeing with the Enterobacteriaceae. There are objectives for this segment that you'll be able to identify Enterobacteriaceae other than Salmonella and Shigella that are associated with gastrointestinal disease. You'll list some new names for species that have undergone taxonomic reassignment. And I want to talk to you about a couple of Klebsiella pneumoniae, which are referred to as the hypervirulent or hypermucoid viscous strains. And I also want to mention some things about Klebsiella oxytoca that you may not know about. So one of the biggest adjustments in the family Enterobacteriaceae has been with the genus Enterobacter. A lot of changes with this group, and I'm going to start with an alphabetical list of the species that are in the genus Enterobacter, and you'll see it's quite lengthy. Starts with Enterobacter aragones, and nothing's really changed with this organism. Many years ago, it was called Aerobacter aragones, but it's been Enterobacter aragones a long time, and it will continue to be that. Enterobacter agglomerans is no longer an Enterobacter. It's been switched to the genus Pantoa as Pantoa agglomerans. Enterobacter aeruginosus, Enterobacter arachidis, Enterobacter asburei, all remain unchanged. Enterobacter cancerogenus is unchanged, but it also includes the organisms that used to be called Enterobacter taylori. Enterobacter cloacae, the most famous of the species, the ones that we probably see every day in our lab, really aren't Enterobacter cloacae. Enterobacter cloacae is a complex of at least 6 species and some subspecies, probably the least common of which is Enterobacter cloacae. And I'm going to break that out for you in just a minute. But Enterobacter cloacae really is not, it is a separate species, but phenotypically we can't separate it from the other organisms in that complex. So we've begun calling these Enterobacter cloacae complex. And so that's a change that you may want to make at your workplace. There's Enterobacter kowanii. On the next slide, we have Enterobacter georgioviae, Enterobacter helveticus, Enterobacter hormaceae. It itself has been divided into subspecies, 3 subspecies of Enterobacter hormaceae. Enterobacter intermedius has been transferred to the genus Kluvera as Kluvera intermedia. And then we have Cobii, Ludwigii, Morii, Nimipressuralis, and Oryzae.